Procalcitonin. It is a valuable biomarker for detecting bacterial infections. But what happens when things are not so straightforward? For example, in patients with renal impairment or those who are immunocompromised, pregnant, or recovering from this surgery, interpreting procalcitonin in such patients can get tricky. Today, we are diving deep into what clinicians need to know when using procalcitonin in these special population. Understanding its limitation can make all the differences in patient care. Stay with us while we break it all down. Chronic kidney disease. A person with chronic kidney disease have higher baseline levels of procalcitonin, believed to be due to higher levels of circulating inflammatory cytokines. Levels drop with renal replacement therapy. After dialysis, levels decline by 20 to 80%, varying with the mode of dialysis used. Despite higher baseline levels, procalcitonin does rise in the setting of infection in patients with CKD. However, the rate of rise may be slower than in healthy patients. Elimination is marginally prolonged in patients with CKD. Immunocompromised state. Procalcitonin production is not impaired in immunocompromised state such as neutropenia, corticosteroid, bone marrow or solid organ transplantation, and human immunodeficiency virus. Observational studies suggest that procalcitonin levels correlate with presence of bacterial infection and the severity of infection in this population. Baseline procalcitonin levels tend to be higher in this population, possibly due to other concurrent causes of systemic inflammation. An optimal threshold for guiding antibiotic therapy have not yet been determined. Because morbidity from bacterial infections can be high in this population, and because immunocompromised patient may require longer duration of antibiotics in general, it is suggested not to use procalcitonin to guide antibiotic discontinuation in immunocompromised individuals. Severe physiologic stressors such as surgery, trauma, or burns can lead to procalcitonin elevations. To identify bacterial infection sepsis in these patients require further study. So, while procalcitonin is a powerful tool in infection management, its interpretation remains a challenge in special population. Additional research is needed to refine its role and to determine whether it truly helps reduce unnecessary antibiotic use. But remember, rather than relying on a single value, tracking procalcitonin trends over time can provide a more reliable basis for clinical decision making. Thanks for tuning in. If you found this video helpful, please do not forget to subscribe, like, share, and hit the notification bell for more medical insights. See you in the next one.